Ready to test your NCLEX skills? Here are 10 must-know questions to boost your prep. Tap the link card to join our free NCLEX practice challenge and keep leveling up. Let's get started. A nurse is caring for a patient who is receiving intravenous IV fluids for dehydration. The nurse notices that the patient's urine output is significantly reduced despite adequate fluid resuscitation. What is the nurse's priority action? A. Increase the IV fluid rate. B. Assess the patient for signs of renal failure. C. Administer a diuretic as prescribed. D. Monitor the patient's oxygen saturation levels. The correct answer is B. Assess the patient for signs of renal failure. Rationale for correct answer. Reduced urine output after adequate fluid resuscitation may indicate renal failure or insufficient renal perfusion. The nurse should assess for signs of renal dysfunction, such as changes in vital signs and lab results, e.g., creatinine, BUN. Rationale for incorrect answers. A. Increase the IV fluid rate. Increasing fluids without assessing the cause of the reduced urine output may worsen renal dysfunction. C. Administer a diuretic. Diuretics should not be used without assessing renal function, as they may worsen kidney damage. D. Monitor the patient's oxygen saturation levels. While oxygen saturation is important, addressing renal function is the priority in this case. NCLEX-RN Test A Tip. Always assess renal function in patients with reduced urine output after fluid resuscitation to detect renal failure early and prevent further complications. Question 2. A nurse is caring for a patient with a history of myocardial infarction, MI. The patient is prescribed an ACE inhibitor. The nurse should monitor for which of the following side effects? A. Hyperkalemia. B. Hypokalemia. C. Tachycardia. D. Hyperglycemia. The correct answer is A. Hyperkalemia. Rationale for correct answer. ACE inhibitors can cause potassium retention, which can lead to hyperkalemia. Rationale for incorrect answers. B. Hypokalemia. ACE inhibitors typically cause hyperkalemia, not hypokalemia. C. Tachycardia. ACE inhibitors generally cause bradycardia, not tachycardia. D. Hyperglycemia. ACE inhibitors do not typically affect blood glucose levels. NCLEX-RN Test A Tip. Monitor potassium levels closely in patients receiving ACE inhibitors to prevent life-threatening hyperkalemia, especially in those with kidney impairment. Question 3. A nurse is caring for a patient who is receiving morphine for pain management. The patient's respiratory rate is 8 breaths per minute. What is the nurse's priority action? A. Administer naloxone, Narcan, to reverse the opioid effect. B. Increase the oxygen flow rate. C. Stop the morphine infusion and notify the healthcare provider. D. Assess the patient's pain level and administer more morphine. The correct answer is C. Stop the morphine infusion and notify the healthcare provider. Rationale for correct answer. A respiratory rate of 8 breaths per minute indicates opioid-induced respiratory depression. The nurse should stop the morphine and notify the healthcare provider for further evaluation. Rationale for incorrect answers. A. Administer naloxone. Narcan naloxone may be necessary, but first, the morphine infusion should be stopped. B. Increase the oxygen flow rate. Oxygen alone won't address the underlying cause, which is respiratory depression from morphine. D. Administer more morphine. More morphine would worsen the respiratory depression. NCLEX-RN Test A Tip. Monitor the respiratory rate and depth before administering opioids, and withhold the medication if the rate is less than 12 breaths per minute. Always notify the healthcare provider if respiratory depression occurs. Question 4. A nurse is caring for a patient with a history of asthma, who is prescribed an inhaled corticosteroid. The nurse should advise the patient to A. Use the inhaler only during asthma attacks. B. Rinse their mouth with water after using the inhaler. C. Use the inhaler as needed for quick relief of symptoms. D. Hold their breath for 30 seconds after inhaling. The correct answer is B. Rinse their mouth with water after using the inhaler. Rationale for correct answer. Rinsing the mouth after using an inhaled corticosteroid helps prevent oral thrush, a common side effect. Rationale for incorrect answers. A. Use the inhaler only during asthma attacks. Inhaled corticosteroids are used for long-term control, not acute symptom relief. C. Use the inhaler as needed. Inhaled corticosteroids are not used as rescue inhalers. D. Hold their breath for 30 seconds. The patient should hold their breath for about 5 to 10 seconds, not 30 seconds. NCLEX-RN test day tip. Instruct patients to rinse their mouth after using corticosteroid inhalers to prevent oral thrush and other oral complications. Question 5. A nurse is caring for a patient who is receiving a loop diuretic for heart failure. The nurse should monitor for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypoglycemia. D. Hypercalcemia. The correct answer is B. Hypokalemia. Rationale for correct answer. Loop diuretics increase potassium excretion, which can lead to hypokalemia. Rationale for incorrect answers. A. Hyperkalemia. Loop diuretics cause potassium loss, not retention. C. Hypoglycemia. Diuretics do not typically cause hypoglycemia. D. Hypercalcemia. Loop diuretics usually cause hypocalcemia. NCLEX-RN test day tip. Always monitor potassium levels closely in patients receiving loop diuretics to prevent complications such as arrhythmias from hypokalemia. Question 6. A nurse is caring for a patient with a history of stroke who is receiving Warfarin. The nurse should monitor the patient for which of the following? A. Signs of bleeding. B. Hyperkalemia. C. Hyperglycemia. D. Renal toxicity. The correct answer is A. Signs of bleeding. Rationale for correct answer. Warfarin is an anticoagulant, and patients are at increased risk for bleeding. The nurse should closely monitor for signs of bleeding, such as bruising or gastrointestinal bleeding. Rationale for incorrect answers. B. Hyperkalemia. Warfarin does not cause hyperkalemia. C. Hyperglycemia. Warfarin does not affect blood glucose levels. D. Renal toxicity. Warfarin is not nephrotoxic. NCLEX-RN test day tip. Monitor for bleeding and ensure that INR levels are within therapeutic range to minimize the risk of bleeding in patients on warfarin. Question 7. A nurse is caring for a patient with chronic kidney disease, CKD, who is prescribed erythropoiesis-stimulating agents, ESAs. The nurse should monitor the patient for which potential side effect? A. Hypertension. B. Hyperkalemia. C. Hypoglycemia. D. Hypercalcemia. The correct answer is A. Hypertension. Rationale for correct answer. ESAs stimulate red blood cell production, which can increase blood volume and lead to hypertension. Rationale for incorrect answers. B. Hyperkalemia. ESAs do not typically affect potassium levels directly. C. Hypoglycemia. ESAs do not affect blood glucose levels. D. Hypercalcemia. Calcium levels should be monitored in CKD, but are not directly affected by ESAs. NCLEX-RN test day tip. Monitor blood pressure regularly in patients receiving ESAs, particularly in those with CKD, to prevent complications like hypertension and stroke. Question 8. A nurse is caring for a patient who is receiving intravenous, IV, potassium chloride for hypokalemia. The nurse should administer the IV potassium at a rate no faster than A. 10 milliequivalent per hour, B. 20 milliequivalent per hour, C. 30 milliequivalent per hour, D. 40 milliequivalent per hour. The correct answer is A. 10 milliequivalent per hour. Rationale for correct answer. Potassium chloride should be administered no faster than 10 milliequivalent per hour to avoid the risk of hyperkalemia and cardiac complications. Rationale for incorrect answers. B. 20 milliequivalent per hour. A faster infusion rate increases the risk of complications. C. 30 milliequivalent per hour. This is too fast and may cause severe complications. D. 40 milliequivalent per hour. This is an unsafe rate for administering IV potassium. NCLEX-RN test day tip. Always administer IV potassium slowly and monitor the patient for signs of hyperkalemia, such as cardiac arrhythmias. Question 9. A nurse is caring for a patient who is receiving a high dose of corticosteroids for asthma. The nurse should monitor for which potential complication of long-term corticosteroid use? A. Osteoporosis. B. Weight loss. C. Hyperglycemia. D. Hypokalemia. The correct answer is A. Osteoporosis. Rationale for correct answer. Long-term corticosteroid therapy can decrease calcium absorption and lead to bone loss, increasing the risk of osteoporosis and fractures. Rationale for incorrect answers. B. Weight loss. Corticosteroids typically cause weight gain due to fluid retention. C. Hyperglycemia. Corticosteroids can raise blood glucose, but osteoporosis is a more common complication. D. Hypokalemia. Corticosteroids can cause potassium retention, not loss. NCLEX-RN test day tip. Monitor bone density and calcium levels in patients on long-term corticosteroid therapy to prevent osteoporosis and fractures. Question 10. A nurse is caring for a patient who has just undergone surgery and is receiving morphine for pain management. The patient reports feeling drowsy and having difficulty staying awake. What is the nurse's priority action? A. Administer an additional dose of morphine. B. Encourage the patient to rest and monitor closely. C. Assess the patient's respiratory rate and oxygen saturation. D. Notify the healthcare provider immediately. The correct answer is C. Assess the patient's respiratory rate and oxygen saturation. Rationale for correct answer. Drowsiness and difficulty staying awake can indicate opioid-induced respiratory depression. The nurse should assess the patient's respiratory rate and oxygen saturation. Rationale for incorrect answers. A. Administer an additional dose of morphine. This would worsen the respiratory depression. B. Encourage the patient to rest. Monitoring the respiratory rate is more important in this situation. D. Notify the healthcare provider immediately. Notification is necessary, but assessing the respiratory status is the immediate priority. NCLEX-RN test day tip. Always monitor respiratory rate and oxygen saturation closely when administering opioids to detect early signs of respiratory depression. How did you do? Light bulb. Whether you crushed it or need more practice, don't stop now. And hey, if this helped you out, don't forget to like, subscribe, and hit the bell so you never miss a question drop. You've got this.